way for us to share this information with healthcare providers and other caregivers. So I wanted to briefly touch on our caregiver-friendly healthcare. And really what this does is it really focuses on ensuring that family and friend caregivers feel valued, supported, and included as partners in care. And so we really believe that everyone can help accelerate caregiver-friendly health care when they focus on their particular place of influence across different healthcare systems. And we're going to touch on the fact that caregivers end up intersecting with the healthcare and community sector at so many different places, and there's so many different opportunities for them to be identified, referred, supported, and part of the caregiving team. So we'll go on to the next slide, please. So this is just a touch point to remind listeners that over 80% of care is done by family and friend caregivers, and that in fact 28% of our British Columbians are caregivers, so about 1.3 million, and that family caregivers really end up being this valuable member of primary care teams and networks. And I mean, they offer so many different areas of support, but often what you might run across in your work with family caregivers is that they end up getting medication, they end up help with hospital discharge planning, they end up doing a lot of the care management for the individual they're supporting. They often provide transportation to medical appointments, to tests, and end up helping with equipment for home use. They really provide key medical, functional, and emotional information for the person that is being cared for. They often end up monitoring how treatments are going, how recovery, health status, and they end up doing a lot of care coordination around booking and attending follow-up appointments. And that's just to name, a few. And so with them often managing and supporting that care recipient, being able to be part of some of those conversations and being able to contribute information is a really important part to for the care recipient's overall well-being, and as well for the caregiver to be able to provide that support. Next slide, please. So one of the ways that healthcare professionals, they're in a very unique role in the sense that healthcare professionals are often, one of the first places that care recipients and often family caregivers are seen and heard, whether it's through a visit from a case manager, whether it's a visit to a family physician, a specialist. And so one of the ways that healthcare professionals can help identify family caregivers and their role is to ask patients with complex, chronic, and life-limiting conditions, is there a family member or friend who helps you manage things at home, or did someone bring you to the appointment that you might like to have in the appointment with you? Even better, sometimes there are some practices where they're often included in a new patient questionnaire, and so they'll often ask that patient if there's someone who helps, supports them at home, or whether or not they want to include that person as part of their care team. So that's one way to kind of help identify family caregivers. One of the often another way is if you have a clinical order set, you can actually just include the question in that order set. And what we have found is that because caregivers often don't self-identify, it often takes multiple times. And so if asking the first time doesn't result in a yes, I do have a family caregiver, or for that family caregiver or friend caregiver to identify, sometimes it's being able to ask the question at different points during that sort of healthcare system journey. Next slide. So we have a program called the Caregiver RX, and there's two main ways that healthcare providers or community sectors can help refer family caregivers once they've been identified. So The yellow sheet, that's called our caregiver prescription pad. And it's our 10-second handoff. We received feedback and information from family physicians saying that one of the barriers, identified barriers, that the time they have to spend with family caregivers can be limited. And so they challenged us to find a tool that they could utilize in 10 seconds. And so we developed this prescription pad where they simply can write the individual's name and tear it off and encourage them to call Family Caregivers of BC and be able to provide support to them. And Family Caregivers of BC then is able to spend time with them on the phone, help them with how to navigate the healthcare system, provide them with emotional support, help them prioritize and develop an action plan for themselves, not just as a caregiver and caring for someone, but actually for their overall well-being. And so what I was going to offer out is that if any of you would like some of these caregiver prescription pads at your clinic or in your place of practice, if you just want to send us an email with your name and your email address, you can put in the chat box. If you're comfortable with that, then we will absolutely follow up and make sure we get those prescription pads out to you. The second way is a bit more of an active referral, and you'll see we have a 8.5 by 11 referral form. And so these forms can be downloaded from our website. They can be, we have actually an online referral form where you can just fill in the information online that comes directly into our email. And this provides a little more information. And when you fax this in, or when you submit it electronically, we then follow up with the family caregiver directly. And so we have found that these two methods of referral tend to provide the best way for healthcare professionals to refer and to know that they're able to ensure that family caregivers have access to resources for themselves out in the community. And so very quickly, when someone calls us, they receive free one-to-one support on the phone. We end up identifying what their needs are, and then we can refer them out into either local caregiver support programs, other programs that are going to help with, whether it's housing, transportation, medical equipment, how to navigate the healthcare system. In some cases, we can provide some one-to-one coaching, and all of these services are free. And so we have a mantra where people say, well, when should we refer? And our response is, anytime is a good time to refer. Because as we'll quickly touch on, family caregivers, their trajectory is can be as long as 6 years, and so they're going to need different types of supports at different times along that journey. We'll go to the next slide. So here is the caregiver trajectory. Now, I will say that this particular one assumes that the individual has an illness that is, chronic, and that it doesn't necessarily, there isn't a recovery phase. And so we often see this with a number of the individuals that call into our line. They're caring for individuals with, with complex medical conditions. And so we'll see that, that there's different stages of caregivers, and caregivers require different information at different times. And they often might, for example, need a referral into Family Caregivers of BC at the start of their caregiving journey. And then what happens is they end up getting information, they end up, taking on some different responsibilities, and things are fairly stable, and then things change, and then they'll often come back into Family Caregivers of BC for more support, or they may end up interfacing with healthcare providers at a different phase as well. And so knowing that you can refer anytime during that caregiver's trajectory is key, and to know that they're going to require different types of support, which is something that we're able to provide from a nonprofit organization. And we have access to a wide variety of different contacts and local programs and resources across the province. Next slide. So before we get into this idea of consent for caregivers, I think it's really important that, of course, we're not legal experts in this area. The primary purpose of the next couple of slides is really to have this dialogue and shared information on how we can support caregivers in their role, include them in care, as well as how to ensure that they're educated in obtaining support. And so, as I mentioned earlier, this really came out in speaking with healthcare providers and caregivers. We were finding that understanding consent isn't always clear, and it's quite confusing. Whether you're a hospital, whether you're trying to connect with the care recipient's family physician, or whether it's whether it's someone who is providing some type of specialty treatment, that there's different processes for obtaining consent. And so, of course, there's the two different types of consent, implied and express. And as we know, in terms of express consent, and this is really required when personal information is intended to be collected, disclosed, or used outside of the circle of care. And that family and friend caregivers, that they need this express consent provided by the patient themselves to be included or to have information shared with them. And this is often like the first step with family caregivers to understand that difference. And so it's not always intuitive, or family caregivers, from our call line, what we hear is that they're not even sometimes aware of express consent. And so I think that's just really good information to understand that every caregiver or every individual has a different level of understanding of how the healthcare system works, and even how our privacy acts work. And so being able to help support them in understanding that type of consent is really important as a first step. Next slide, thanks. So really what we have found in connecting with healthcare providers, and of course, based on connecting with other caregiver support organizations and taking a look at some of the documents out there that that explain obtaining consent, a lot of the time it is really in how we ask. And so sometimes taking a more personal, softer approach can really help the care recipient understand the purpose of including a trusted friend or family caregiver. And I think that's the premise is generally when a caregiver is trying to obtain consent, it's usually because the person that's requiring support and care might be struggling with capacity to make some healthcare decisions independently, or they're faced with some other complex conditions that are impacting their ability to manage independently. With this greater understanding that generally most family and friend caregivers understand that at the end of the day, the individual, the care recipient, is autonomous and has the independence to make those decisions. And so sometimes the softer approach often gets at that importance of autonomy and independence, while still promoting the concept of sharing information with the trusted care team, and understanding that privacy is really at the heart of these conversations. And so we've just in some of the little bubbles there, we've just put up some possible wording that healthcare providers can use when trying to find a softer approach. Often, sometimes it's also when it comes from the healthcare provider, the care recipient or the patient is going to see that perspective and maybe help them understand that having their family caregiver for support and as part of the care team is going to help with their own ability to remain independent and their ability to make some decisions that are going to be informed, for themselves going forward. Next slide. So one of the things that we come across with family caregivers, on our support line is, in particular, with individuals that have some cognitive changes. And so this idea that when the patient says no the first time, that there's opportunities to repeat the request at different times and in different appointments. And if possible, sort of an extra understanding the value of the family caregiver in those circumstances can, help prompt the conversation of understanding why perhaps that individual is reluctant to share information with their caregiver. Of course, at the end of the day, and this is what's provided to family caregivers from the caregiver support line, is this acceptance that if the individual, the person they're caring for, the patient, is still indicating they don't want that, that we have to honor that, and that their medication treatment plan and progress isn't going to be shared. There are some ways to provide assurance to the family caregiver if that's the case, and we'll cover that in the next slide here. So when caregivers don't have consent, it's also helpful to, where possible, to provide them with some validation and support. Because at the end of the day, if they don't have consent, but they are still doing the bulk of the care, it's helpful for them to, have as much control as possible in how they're able to provide support and care to that individual. The caregiver is really impacted by the care recipient's illness. And in fact, we know that for individuals who are living at home in the community, that caregivers, are usually the main reason on that individual being able to remain at home. And so the caregiver's well-being and their ability to maintain, their own self-care as much as possible is, directly related to, the patient or the care recipient's illness. And so obviously, if we're dealing with patients that are chronically ill and they require heavy care, we know that over time that's going to have a major impact on caregivers. And so assuring the caregiver that the person they're caring for is okay and they're getting good medical treatment, offering a little bit of hope, acknowledging that this is really difficult to hear that you can't have consent, and that you'll keep trying, I think often, helps keep that caregiver feeling informed. And then secondary to that, often just asking how the caregiver's doing, asking if there's anything, that they're doing to take care of themselves, just to acknowledge their role, can go an incredibly, a long way in making them feel seen and heard. Next slide. So we likely don't need to go over the benefits of including caregivers. You're probably all completely aware of this, but caregivers really know things from providing care, support, and arranging things. And, their role can really actually help healthcare providers in understanding, it changes over time, how treatments are working, trying to provide a sense of if things have changed, since the last appointment, major areas of concern, can help sort of validate some of the medical assessments, and, diagnosis can help bring context into that. So caregivers often, that's why they want to be part of the care planning team, or having input or receiving consent, is because they end up, providing context for the individual when maybe they're not able to necessarily advocate for themselves, or they just have some limitations or some challenges that that alter or affect the way that they can communicate information in medical appointments. And so having caregivers, as part of that process can really benefits the care recipient or the patient's outcomes, and also in turns, provides the caregiver with validation with other tools and resources to help them continue caring. So one of the, I guess, the other things that is helpful in this particular thing is, for example, if you're in this situation with a caregiver, you're noticing that their levels of distress are increasing. If they aren't a patient of yours as well, you could certainly ask for permission to connect with their healthcare provider, and be able to interface with them in terms of ensuring that their healthcare provider is aware of their level of caregivers, stress as well. That's another way that we can provide support. Next slide. So I understand we're going to be sending out this presentation afterwards. There's going to be a number of resources that you can tap into. There's lots of information, of course, out there. Again, we wanted to just provide a very, a snippet of information around how to have conversations with caregivers, how to support them in obtaining consent. The one thing that we also hear from family caregivers is that they just don't understand the physical processes. So it would be wonderful to know if any of the clinics have a one-pager, for example, that outlines steps for how family and friends caregivers can obtain consent, whether it's at a clinic or in a hospital setting. That's often a question that caregivers often ask on our caregiver support line is, I just don't know, what the first step is. And so we obviously provide some general support around that. But if anyone has information or, is willing to share what's worked well for them, feel free to put that in the chat box as well. And our next slide, I think, is just a few more resources. Yeah.
I just wanted to pop on. Thank you for letting me know the chat box wasn't working initially. So I apologize for that. And just a comment here. If you have questions, you can put it into the Q&A or the chat box, whatever's easiest. But we have someone just stating that it is concerning that doctors are consenting to give drugs to the patients when the caregivers are not aware or consenting to it.
Mm-hmm. Yeah, that's a tricky area. I was doing some reading earlier today, and there are some different regulations around medications, and of course we're not experts in this area. So I mean, unfortunately, I can't speak to that, but I know that is an area that there are some different regulations around. And there's actually a really great document that was prepared by the Law Association of BC. They did a whole area, so maybe we can attach that PDF just because I found it was, it was quite. There was a lot of really good information in that. It was quite technical though as well. Yeah. So.
And just with this slide, just so it makes sense. So a lot of our content from this PowerPoint was taken from Ontario Caregivers, and it was adapted. They were doing their own changing care, and it was a specific project they were working on around consent and law specific for Ontario. So this is just a note of some of the things that we'll include in the handout that will go out tomorrow. And then the last slide is just for questions. So if you do have questions or comments that you would like to drop into the chat box or the Q&A, And yeah, thank you for putting your name for our XPAD. I'm happy to capture that and send those.
Yeah, that's too bad the chat box wasn't working. Thank you. Yeah, and so I think it's I guess maybe if I could, wrap up, there's some really good comments, just that sometimes it's a process, and sometimes it takes multiple attempts to obtain consent, and sometimes it's equally about the individual, the patient, and the care recipient arriving at a place for themselves as well. And I guess I suppose I would say that to stress that providing our trusted individuals with consent now it's probably the best method, rather than waiting when we're faced with multiple challenges. Of course, that doesn't always happen the way we'd like it, but yeah, it can be a process. It's not always easy. Sometimes it is. And so becoming familiar even now with how the person you're caring for, where you might be intersecting in having to get consent, and understanding that can even just be a little takeaway, and even starting to have those conversations with the person you're caring for, or even your spouse if you're not caring for each other yet. Going, oh, geez, let's learn from this and just give each other, consent. We may not need it, but at least, we are being proactive that way.
Yes, Carrie, let me pull that up for you. This is for, the electronic forms.
Yeah, we can do that.
Yeah, I can just pull that.
That's great. Yeah, it's on the website, and there's Kate will put in the link in the chat box. Oh, that's interesting. Yes. So, right, healthcare representation agreement. Right. Yeah, I guess this is also understanding how the different legal documents that we have in place, what's required. So for example, I know that, having a healthcare representation agreement can be utilized in different parts of interfacing with the healthcare system. But sometimes, for example, at a medical clinic, there actually needs to be assigned consent. And so I think that's probably a direct conversation with the healthcare provider, because getting consent at one part of the healthcare system doesn't translate across the whole system. And so it's sort of this very unique, customized understanding of like, oh, when I go into the medical clinic, I need a different form than if I'm dealing with a case manager with my local health authority, or with another specialty team. And so again, that's a bit frustrating, but there are different systems. Yeah, and then we didn't even get into the temporary substitute decision makers. Again, that is a whole other conversation. Yeah, I'm just trying to read a couple of these comments.
Yeah, there's another, I think it's similar to, I'm just pulling that from our question box too, where it's that representation agreement and enduring power of attorney, and where, and saying that they need to get a signed doctor's assessment, but she no longer has a doctor. So where do I go for these assessments?
Right. Okay. I didn't see that one. That's yeah. It definitely feels like we could probably do another webinar on this, and a more expanded one, to address some of these particular questions, and really having someone that really understands, the legal side of things and how each document can be utilized, would be helpful. So that's certainly a takeaway for us. We'll be happily take a look at this for future webinars. So thank you for all those questions.
Yeah, I'm just copying them down. We have a lawyer that writes for our Caregiver Connection newsletter, and I feel like some of these questions are geared to her, and I feel like this would be a great second step. So yes, thank you for sharing and asking.
Yeah, and thank you for all your comments. Yeah, sort of knew that this could open up, Pandora's box. Yes. So it certainly will give information, to be able to help direct future webinars. I don't think anyone would disagree that it could be easier, and I think hopefully there's opportunities to try and streamline processes. It's just I think it's just, very much understanding, even though it's incredibly frustrating, that this is sort of the system that we have, and trying to figure out how do we best work within that system. I completely agree that it should be easier. It would be nice if there was just one little form that could be submitted electronically and everyone could have access to it. So. But we're not quite there yet. We can still hang on to hope. Yeah, that's great. Thanks, Carrie. That's great. Yeah, it'd be great to have family and specialist physicians' input on what patient privacy regulations, they're bound by. Absolutely. And how those can conflict with, that's a great comment. Thank you for that.
All right, just being mindful of time. Thank you, Wendy, for sharing your knowledge and perspective with us. And also, thank you for joining us. This webinar is recorded. It will be sent out, and we will also have a list of our resources we mentioned in our presentation this evening. So thank you. And until we have another webinar, we hope to see you again then.
Thank you. Have a great night, everyone.
Bye.
Bye.